Hi, medical coding buddies. How is everyone doing? Welcome to this special live feed. Um, and I wanted to do this live feed because there's some breaking news that's happening in the industry. As if you know, tomorrow is April 1st, and it's not an April Fool's joke, but by now you should have been able to go through some webinars and some special webinars with your place of employment in regards to COVID-19 and the new reporting tools that is going to be required as of tomorrow. So I just wanted to spend some time on it and to go over it with you to make sure that you guys are aware, for those who are not, on how to capture it. Now, for new individuals on the platform who does not know who I am, my name is Kevin Vassiana. I'm a medical coder. I've been in the industry now for 20 plus years. Um, and today we had a special webinar with Don Self, and I want to take this opportunity to say thank you again, sir, for helping me with this webinar that we did today on the telemedicine and telehealth coding portion of it. The procedural code, the E&M coding, and all that good stuff. And those who were a part of that webinar, I'm pretty sure you guys had a wealth of information imparted upon you. And I'm pretty sure you were able to now go forth and practice likewise in your practice, in your place of employment. And if you're having issues with knowing how to code it, he is the person, he would be the guru that you would need to reach out to. I would highly recommend that you reach out to him. If your practice is having issues on how to report those code sets, I would highly request that you reach out to him and try to ascertain how to best bill and code for those services. But what I'm trying to talk about tonight is the new diagnosis reporting guidelines that has been issued, and I want to make sure that everybody's on the same page. Please do your homework, research, pass them by your supervisor, your auditors, all that good stuff. My word is not the final word of authority. I just research information and I give them to you as I get them. And so I don't want you guys to go back and say, well, I heard it from this particular source. No, I want you guys to make sure you get it from your supervisors as well. But at least you can say you heard it somewhere, right? That's how I practice, and that's how I want you guys to behave when it comes to this industry. So let me go over some stuff that I found out, right? I'm going to try to maximize this. Let me see if it works for me. And I'm going to try to zoom in. Let's see if that works for me. Just give me a second. All right. Bring it down a notch. And for those who can see it, so as of tomorrow, April 1st, your new code for COVID-19 is U07.1. And if anybody wants me to email this to them, please DM me and I will email you this little snippet that I picked up on. Your new diagnostic code is U07.1, right? Now, what you need to know is that if pneumonia is confirmed as due to COVID-19, then U07.1 would be reported, followed by the J12.89 for other viral pneumonia. Okay? That is the sequencing there that you need to follow for that rule. Hold on one second. Let me see. There's no way to gauge questions, but I'm pretty sure I'm getting them. Let's see. No. Okay, that was not relevant. But you guys can comment. Let me see. You guys can comment on the chat, and I can see your messages. So if you have particular questions while I'm going through this, you can place a comment, and then we will try to research it together. Okay, but again, so I'll repeat this. Your 7.1 is for COVID-19. That's a new code as of tomorrow. Okay, if you have a pneumonia case and is confirmed with as due to COVID-19. It is J12.89. If they don't have pneumonia, somebody asked, what if they don't have pneumonia? Then it would be just the UO7.1, I believe. So if they have nothing else going on with that patient, it would be the UO7.1. Now, if they have acute, hopefully that answers your question. Believe it is UO 7.1 if they don't have the pneumonia, nothing else is going on. But if they says pneumonia confirmed as due to COVID-19, UO 7.1 followed by the J12.89. If it's acute bronchitis confirmed as due to COVID-19, UO 7.1 followed by J20.8. UO 7.1 followed by the J20.8. If it's unspecified bronchitis confirmed as due to COVID-19, UO 7.1 followed by J40 diagnostic code. If it is acute or lower respiratory infection as due to COVID-19, report UO 7.1 followed by J22. All right, and J22 signifies unspecified acute lower respiratory infection. If it's respiratory infection not otherwise specified, confirmed as due to COVID-19, you report UO 7.1 followed by J98.8, like other specified respiratory disorder. If it's ARDS, acute respiratory distress syndrome, confirmed as due to COVID-19, report UO 7.1, COVID-19, J80, acute respiratory distress syndrome as a secondary diagnosis. Hopefully this is helping you guys. And I'll publish this as soon as we're done so everybody can see it. Possible exposure to COVID-19 ruled out with a D, ruled out after evaluation is Z03.818, encounter for observation for suspected exposure to other biological agents ruled out. If it's exposure to COVID-19 not related, or not ruled out, it is Z20.828, Z20.828, contact with and exposure to other viral communicable diseases, right? Signs and symptoms, it says, if a definitive diagnosis has not been established, only call the signs and symptoms, example, cough, shortness of breath, fever, etc. If it's suspected, possible, probable, do not utilize UO 7.1. Instead, you're going to use the signs and symptoms followed by Z20.828. So usually they come in, they will have cough, fever, those kind of issues going on. Also, make sure if they did a chest X-ray, I would immediately go there to see exactly what is being reported on the chest X-ray, because sometimes I see that in the ERs, they will, you know, in these cases, they do a chest X-ray. Now let's go to the CMS website, because I pulled up another plug, a HEMA website rather. Pull up another one here that confirms exactly what is happening. So remember, this is effective April 1st. Effective April 1st. Okay. Question that was posed to a HEMA. What is the ICD-10 code for COVID-19? I said it before. UO 7.1 is the code as published by World Health Organization. Question, is the new ICD-10 code UO 7.1 a secondary code? The answer, no. When COVID-19 meets the definition of a principal or listed diagnosis, report UO 7.1. COVID-19 should be sequenced first and followed by the appropriate codes for associated manifestations, except in the case of newborns and obstetric patients. Okay? Question, are there additional new diagnosis codes or to identify other situations specific to COVID-19? For example, codes for exposure to COVID-19 or observation or suspected. Um, Now, as of 320, this is what the answer was. No, at the present time, at the there are no other COVID-19 related ICD-10-CM codes. However, the Centers for Disease and Prevention's National Center for Healthcare Statistics is responsible for maintaining ICD-10-CM in the U.S. is monitoring the situation. I just went over some other stuff with you a while ago that was just recently published. So those you need to pay attention to. Question. We have been told that the World Health Organization has approved an emergency ICD-10 code of UO7.2. Virus not identified. Is code UO7.2 to be implemented in the US also? Answer. The HIPAA code sets standard for diagnosis coding in the US is ICD-10-CM, not ICD-10. Difference. Okay? As shown in April 1st, 2020 agenda on the CDC website, the only new code that's approved to be implemented in the United States is UO7.1. Question. How should we code cases related to COVID-19 prior to April 1st, 2020? The effective date of ICD-10-CM code is UO7.1 COVID-19. Answer, please refer to the supplemental. Well, we're not going to worry about that because guess what? Tomorrow is April 1st. So ignore that question. Question, is the ICD-10-CM code UO7.1 retroactive to cases diagnosed prior to April 1st, 2020? Answer, no, the code is not retroactive. Okay, so it's effective for April 1st cases. Question, is code B97.29 other coronavirus as a cause of the disease classified elsewhere limited to COVID-19 cases? No, code B97.29 is not exclusive to the SARS-CoV-2 2019 virus responsible for the COVID-19 pandemic. The code does not distinguish the more than 30 different varieties of coronavirus, some of which are responsible for the common cold. Due to the heightened need to uniquely identify COVID-19 until the unique ICD-10-CM code is effective April 1st, providers are urged to consider developing facility-specific guidelines. Okay? Well, tomorrow is April 1st, so we're not going to worry about that question. All right, this one is a lengthy one. What is the difference between ICD-10-CM codes B34.2 versus B97.29? B34.2, coronavirus infection unspecified, would in generally not be appropriate for COVID-19 because the cases have universally been respiratory in nature. So the site of infection would not be, where am I left off? The site of infection, hold on one second. The site of infection would not be unspecified, B97.29. And let me just go down to the bold. Because code B97.29 is not inclusive to the SARS for COVID-19 pandemic, we are urging providers to consider developing facility-specific coding guidelines when reporting it. Well, tomorrow we're using UO7.1. And it goes on. Let me see. It was a specific. And if anybody is utilizing these codes, is very familiar with this, feel free to chime in the comment section. Let me know what you are doing on your job. This is the platform where we share information. So if you have information as to what you're doing on your job right now, please share. Please feel free to share, and then we will include those comments as we're doing this live. Let's see. Should a presentive, here's another one that I keep hearing people floating around. Well, actually, let me go back to this one about Zika. The supplemental ICD-10-CM official guidelines for coding encounters related to COVID-19 outbreak refers to coding confirmed cases in a couple of instances, but it does not specify what confirmation means, similar to language in guidelines found for reporting of HIV, Zika, and H1N1. Can you clarify whether the record needs to have a copy of the lab results or what lab tests are approved for confirmation? The answer, the intent of the guideline is to code only confirmed cases of COVID-19. It is not required that a copy of the confirmatory test be available in the record or documentation of the test result. And I know I, for one, have come across cases since last week um, where the doctor documented in the final impression uh, COVID-19, but in the body of the record, he tells me that he took the required test and he sent it out to the lab. Really confused the heck out of me because I was at that point trying to baffled as to what to do with that case. Because on one breath he was telling me, yes, the patient has it, and in the other breath he's telling me, well, I just sent out the test to the lab to confirm it. So, so the other question leads up to that. Should presumptive positive COVID-19 test results be coded as confirmed? And this is the answer. Yes. Presumptive positive COVID-19 test results should be coded as confirmed. A presumptive positive test result means an individual has tested positive for the virus at a local or state level, but it's not yet been confirmed by the Centers for Disease Control and Prevention. Confirmation of local and state tests for the COVID-19 virus is no longer required. How should we handle cases related to COVID-19 when the test results aren't back yet? Okay. The supplementary guidance and facts are confusing since sometimes COVID-19 is not ruled out during the encounter since the test results aren't back yet. Due to the heightened need to capture accurate data on positive COVID-19 cases, we recommend that providers consider developing facility-specific coding guidelines to hold back coding of inpatient admissions and outpatient encounters until the test results for COVID-19 testing are available. So how I released my claim was I just applied the Z20.828, applied the symptoms, and sent it on its way based on supervisor's guidance, because that was a very baffling case as to why would the doctor apply COVID-19 as a final impression, but at the same time, in the other breath, telling me, well, I just sent it out for testing. And I don't see any results coming back saying it was positive. It was like the stay in the emergency room was less than 30 minutes. I'm pretty sure he didn't get the results back that fast. We now have a rapid test that's being deployed, I believe, in the next couple of weeks from another company, Abbott Technologies, I think they're called. And there's another company as well that's doing a rapid testing that you can pretty much see the results within 2 minutes. So those things are in the workings. Those things are coming. But right now we're not there yet. Based on the last press conference I just watched with the president and the folks at the CDC and all, etc., that's what I'm being told. That's what I'm seeing. And that's what everybody, the entire nation is learning everything at the same time as to how fast the test results can come back. So that's what's happening in COVID world. We hope to God that we do not live like this forever. I pray, but as we get information, as I get information, I would love to share them with you guys. As you get information, you can pass them along to me, and then we can share them together. And we can just do a live video and just share them together so we all can learn from one another. That's the purpose of the platform, and that's the goal. I want everybody to learn, everybody to grow, because this is an evolving situation. It's rapidly evolving. Every day we learn something new. I have not ventured out of my house now for 3 weeks. I've been home. Luckily, I work from home. My poor wife has to be the one to go out and buy groceries and all that good stuff for me and my son, but it is what it is. It's a new world, and I got to learn to cope with it. So I've been doing a lot of gardening, and I know you guys have been doing your little things to kind of pass time. And so, as you know, this is what we have to do. We lift each other up on this platform, and we hold each other's hand, and we can hopefully get to a new day, a new light, a new time when things are going to be better. So let's continue to keep everybody in your thoughts and prayers, and as we go through this motion. So that is COVID-19 in a nutshell. That's the presentation I want to drop to you guys. So if you guys do not have this yet, hit me up and I can email it to you. But it is on the HEMA's website. Um, you can find it on the HEMA's website. You can find it at aha.org. You can find it on CDC. All this information that I just went over. But if you need it in your inbox, hit me up, because this is a Word document. It's rather lengthy, so I would have to email that to you. So if you don't have access to it directly, so just DM me your email and I'll send it out to you. And the other one I will post on the platform so you guys can see it as far as the combination is concerned. So that's where we at. Okay, so just DM me your information. I see people are saying yes, please. So yeah, I'm not seeing your name. So yeah, just go ahead and DM me your email, and I will get it out for you, and you will see it in your inbox. But yeah, that's it. And again, my name is Kevin Vassiana, and you can find me on the platform and one of the admin on in the team. And there is right now 4 of us. Let me see if I have the other picture. No, I don't. Okay, I was going to show you a picture of the team, but I don't have it handy. But there's 4 of us on the platform that monitor this Facebook group. I'm mainly the one that's coming on and doing a lot of the speaking, as you can see. And so you know, feel free to reach out to either of us, and we will get you in the right direction. Any questions? Any feedback? Any comments further before I log off? Feel free. I know there's a lot of new folks that I added today to the group. Welcome. I will say welcome again, because of the positive webinar that we had earlier today at 2:30 Eastern Time, 1:30 Central. We had added a lot of new folks to the group today. So again, welcome, welcome, welcome. And please feel to like, share, comment about the group. All right. So give me 1 second. Let me let this person to my gate. But yeah, so any questions? I see there's 2 individuals still watching. Any questions? So UO 7.1. UO 7.1 is the new code set that we are going to be worried about come tomorrow. All right, UO 7.1. And then there is other rules that you have to worry about too as well for combination coding, and that the sequencing rather of the different scenarios with pneumonia, without pneumonia, that kind of thing. There's a different rules that you have to apply. And of course, you guys know that when it comes to pregnancy complication situations, that's a whole different realm, right? From chapter 15 in the ICD-10-CM book, you know that it's a whole different situation. Yeah, Bonnie, sure. Do I have your email, Bonnie? Please make sure I do. If I don't, just DM me with your email to make sure that I have it, so I can send it out. I'll just do one bulk email, so I'll wait until about probably 8:30ish before I send it out, so that way I capture everybody's email. So I just send one email blast. So if you want to get on that email, just make sure you send me your email prior to 8:30, because around 8:30 I'm going to cut off and start call it a night and get some rest. So send me your email before 8:30 Eastern Time. So that way I can have it, and then I'll just do one email blast. Okay. Now, if there's individuals on the platform or new to the platform that is looking to be a part of the study group meets on Mondays and Thursdays. I can take additional individuals that wants to be a part of that. You have to be committed. We basically, or right now we're going over ICD-10-CM coding. We just wrapped up the digestive system on Monday night. And then tomorrow it'd be Thursday, we will be on to the skin integumentary system, code, and we'll be reviewing that. And then Monday of next week, we should be talking about chapter 15 guidelines as far as OB codes, sets, and all that good stuff. So if anybody wants to be a part of the study sessions, please indicate that, and then I can add you to the study group. I do have space for that. So you just need to DM me your information, and you can do that anytime between now and Thursday, before I send out the new, link for Thursday night session. We meet 9 p.m. Eastern time every Monday and Thursday for 1 hour. For 1 hour, okay? In these sessions, what you will typically have is you will have homework assignments. You will have very different degree of stuff that we go over, and you can ask questions. We're learning from each other. Everybody will have different opinions on different things, but straightforwardly, basically, for the time I've been doing it now, it's just not a lecture. I create PowerPoints and grab information, coding clinics, the whole nine, put it together, and give you a very informative 1 hour Power Pack lecture on that topic. And then you do a coding quiz or test, or at the end or beginning, to help enhance the learning, and make sure that the information that I'm giving to you sticks. Okay. So individuals that are looking to test for either CPC or CCS or even the RHIT in the future, because information there can carry over to different aspects of different things. Okay. Any other questions? All right, Bonnie, I'll look out for your text message. I know I already have one from Sandra. Okay, Sandra, I got your message, and I will send it out. So remember, 8:30 this evening. Okay. Other than that, I'm going to go have some dinner, and then we'll wish you guys a good day, and happy coding, happy coding, and let's continue to lift each other up as we go through these trying times. All right. Talk to you guys soon. Good night.